Hello and welcome back to Curry Soup. Today we're going to be talking about 5 warning signs of heart attack. In 2019, more than 173,000 deaths were recorded just because of heart disease. Worldwide, 7 million people die every year because of heart disease. Yes, chest pain is the most common symptom of heart attack, but it's not the only symptom, and sometimes it may not even be there, it may not even be present. Women in particular tend to have very subtle symptoms and can easily be overlooked. And when it comes to heart attack, time is muscle. That's what heart attack actually means. Because heart attack happens when the blood flow to your coronary artery, the artery which supplies oxygen to the heart, gets blocked. When this happens, the longer it takes, the longer the heart muscles, the heart tissues stop getting oxygen from the body, and more of these muscle cells will start dying. That's what myocardial infarction means, or in layman's term, heart attack. It's usually caused by fatty deposits, atherosclerotic plaque, or aortic spasm, or sometimes aortic dissection, a tear in the lining of your arteries. So let's jump straight into it. Symptom number 1, as you might have already guessed it, chest pain. Chest pain or chest discomfort, but it's usually, when we ask patients, they explain it as pressing pain. It means like they feel as if there's an elephant or something very heavy sitting on their chest, just pushing down on them. That's the kind of pain that they feel. It can be either directly in the center or a bit to the left. Symptom number 2 is either numbness or tingling feeling on other parts of the body. Yes, heart attack can present with pain or discomfort in other parts of the body. For example, your arm, either one arm or both arms, the jaw, the back, the stomach. These are also symptoms of heart attack. So it's very important that you pay attention to your body. If you know that you are in the risk group of getting heart attack, it's very important to pay attention to everything which is happening to your body. Sign number 3 is cold sweat, or in medical term we call it as diaphoresis. Cold sweat meaning all of a sudden you have beads of sweat on your forehead, in your body when the weather is actually cooling, and this is something which is not normal to you. If it's a nice rainy windy weather outside and all of a sudden you are sweating, you feel like you're having chills, then it might be a symptom that you're having a heart attack. Sign number 4, palpitations. Palpitations mean the heart is beating very fast, or rather irregularly. If you're not doing any work which requires a lot of force, if you're not exerting a lot of force, and all of a sudden your heart starts beating very fast, or you can feel your heartbeat is very irregular, suddenly fast, suddenly slow, then this might indicate that you're having a heart attack. And symptom number 5 is dizziness. When someone is having active heart attack, it means their heart is not pumping properly, which also means the circulation to the rest of the body is compromised, and the brain is one of the organs which gets affected by this. So when the brain doesn't get enough oxygen, you're gonna start feeling very dizzy, very lightheaded. So having dizziness or lightheaded is also one of the symptoms of having a heart attack. Instead of stopping after just giving you the symptoms, let me just give some prevention methods, things that you could do in your daily life to prevent heart attack from ever happening. The first and most important is, of course, go for your regular checkup, visit your physician, your doctor, find out if you're in the risk group of having heart attack and what else you can do to stop them, to prevent it from happening. Things that you could do would be like monitoring your diet. Make sure you're eating a healthy, balanced diet, especially if you're in a high risk group. There are certain things you're not supposed to eat, there are certain things that you should eat more of, so you should check out all these and make sure your diet is healthy and appropriate. Besides that, another thing we could all do is exercise regularly, daily or 3 times a week, whichever is more convenient for you, but make sure your body gets some sort of exercise. This will help with improving the blood circulation, your stamina, and everything will improve. Your entire life would be better. If moderate, appropriate exercise is always good for you. Other than that, drinking a lot of water helps as well. And if you're a smoker, stop smoking. Smoking increases the risk of cardiovascular diseases. Quitting smoking is definitely very helpful for you. And most importantly, pay attention to your body. Like I mentioned earlier, heart attack can come with the very typical chest pain symptom, but it also can present with no symptoms at all, or very atypical, very mild, very completely unrelated symptoms. Especially if you're a diabetic, your symptoms are going to be even more subtler. Sometimes just a mild jaw pain or a bit of back pain or a bit of stomach discomfort could be part of the symptom of heart attack as well. If you found this video helpful and valuable, all I ask is share it with your friends and family, spread the knowledge. And until the next informative video, in anything you do, do your best and be the best version of yourself. Bye bye.